Guys, we are nursing ninjas and we are here to help
you in your nursing classes. So we are today discuss about community diagnosis. So we will discuss about community diagnosis, how it will form and how you will use it in your clinical practices during the community postings. So guys, first of all, it's a part different from our nursing diagnosis, but we will include the nursing diagnosis that how according to Nanda diagnosis we will form it. So first of all, we have we have assessment, in which we have three things: actual problem, potential problem, and forcible crisis. We will discuss this later that what it actually contains: actual problem, potential problem, and forcible crisis. Then we will further move on the diagnosis. And community diagnosis, we have to make three diagnoses based on individual diagnosis. Then we have to make family diagnosis. And next we have to make community diagnosis. Then we have our goals. Goals are based on short-term goals and the further long-term goals. Short-term goals are for the specific time period, like 2 days, 3 days, or up to a week. And then long-term goals are specially prescribed to up to 1 month, or for the time period that we have our community postings. Then we have planning and interventions. Why we are including the planning and intervention in the same column? Because here we are not providing interventions. We are only discussing or planning intervention with the family. Not we are providing intervention. Actually, they are having their own choice that they have to implement the interventions in their life or not. We only have to discuss, or we only have to advise the interventions to the family, and based on their choice that they want to adapt it or not, that is their choice. So we are including in this only. So we have providing all the interventions that according to the care, according to the need or problem, that we are providing it. Next we have rational is including as we have providing the intervention, that is the reason why we are providing that intervention, what it will help. Then evaluation includes the things that on the first day what they have told to us ki, why, how they are doing, and what's are their responses. And after follow up of second day, third day, or either you want only 2 days, 3 days after that. So according to second day, third day, fifth day, seventh day, what they have tell, and what's the changes that they feel after that, that's including in the evaluation. Further we will discuss about the actual assessment part is actual problem, potential problem, and forcible crisis. So guys, actually actual problem is that the problem we are facing at present. So example, that I am facing actually I am facing any weakness, any pain due to any condition. So just like hypertension, diabetes mellitus, I am facing like weakness, tingling sensation, or polyuria due to any complaint that we are facing at present that we are facing. And next we have potential problem. So potential problem is that due to actual problem that we are facing. For example, polyuria. Due to polyuria, I am facing difficulty in sleeping. My sleep got disturbed. So sleep disturbance. So further we will move on to forcible crisis. Forcible crisis is just like the condition, or if not treated on time, then what it will leads to any complications. So forcible crisis, that in future what it will happen, it's not treated at that time. Then it's like polyuria है तो diabetes है, तो diabetes की वजह से diabetes mellitus leads to any complication. Got it? Then we will further move on to the diagnosis part. In the diagnosis part, we have three diagnoses: individual diagnosis, family diagnosis, and community diagnosis. In this, we always don't have all of them, individual, family or community. We can have any of them, either family community है या फिर individual alone है या फिर family और individual है community नहीं है या फिर individual नहीं है family और community है. Then we will make diagnosis based on that. So just like any person or individual having malnutrition or anything, so we will make diagnosis. So just like individual, due to individual, what are the changes that due to which thing the malnutrition is occurring. So just example that due to insufficient intake of dietary patterns or dietary habits, as well as what other things that we will make. So just like individual, malnutrition, this is our problem, malnutrition related to less intake of food, as evidenced by. So how we will evidence that the person is having malnutrition? By taking nutrition assessment as well as their BMI, height, weight, according to height, whether they have their appropriate weight or not. So evidenced by our physical assessment and BMI. So further, the family also includes one or two persons in the family, as well as why they are contributing towards malnutrition. Is there any thing that family thing contributes towards the malnutrition? Just like family. The method of cooking, the method like large family size, or due to improper distribution, that only males, due to dominancy, only males had provided the good food, the best nutrients, not the family of the females or the girls. So that's why that is malnutrition due to either large family size or improper distribution of food, of resources or food among family members, or improper cooking habits. Evidenced by either the watching or observing their cooking habits or asking from them, as evidenced by taking survey, community surveys. So we will know about the practices or the things that they are following during their food making or other things, or history, either also by the observation. So in community, further we will move on that how community is playing the role in this. So either due to the area having no availability of resources, as well as they are having low economic status, due to which they are not getting the proper nutrition, the proper diet. So malnutrition related to low availability of resources, as evidenced by low socio-economic status. Get it? So that's about our community diagnosis. And I have told earlier about the short-term goals, that is up to a week or few days, but long-term goals are more than week or up to a month. Got it? In planning that due to malnutrition, what we can provide other supplements, like if we can replace the resources, like other cheap resources, other cheap resources. So based on what is the cause, we will further change the interventions. So just like if low economic status, other cheap resources, or if there is no accessibility, so we will connect it to other resources like the sales person that can come to the village or the area, so they can provide proper food. Or if a low economic status, we can so just like ragi, we can replace it from wheat, or we can also take bajra. So just like ragi is rich in calcium and iron rich and calcium rich hai, so we can provide ragi food to the persons. So it's like this one, as well as due to cooking methods, we can change the method of cooking. Menu planning, we can include all the type of the meals, that all the type of the food that we can include, that rich in all the vitamins and minerals provided to the family members. So that's a guide. Thank you so much. You have come to that our channel, and we will further discuss about in next videos. Thank you so much.